Yes, you're welcome. It's your boy Jacob here. Some of my friends in my country, Uganda, wanted me to compare a bachelor's degree in anesthesia and a bachelor's degree in nursing. Which of those professions is better? Yes, I can say all of them are good, whichever profession you choose. But you have to know that a bachelor's degree in nursing has stayed over for a long time. It's very popular all over the country, in many countries. A bachelor's degree in anesthesia is kind of new. Most of the anesthesia providers in my country are diploma holders, and in other countries, in Kenya as well, they are diploma holders. In Tanzania, majority were certificate holders. So you have to compare with other countries. So a bachelor's degree in anesthesia for non-physicians, people who are not doctors, uh, majority they are on diplomas and certificates. Even if you look over all over Africa, majority of non-physician anesthetists as diploma holders. There are few countries with degree. So a bachelor's degree in anesthesia for non-physicians quite new, and most people don't know about it. So one of the advantages the BSN may hold is its popularity. Most people know about it. That's the thing I can say, which is a little bit different. Qualifications and length of study is almost the same, 4 years for both of them. So there's not much difference there. Job opportunities, can talk about job opportunities. BSNs have a government scale now. You can go government and earn a government wage on a degree scale as a BSN nurse. For bachelor degree in anesthesia, they don't have a scale yet. The anesthesia providers now in Uganda, their scale is on a diploma level, which is equivalent to all diploma nurses. So that is something they also have to fight for, to get a scale of a bachelor's degree in anesthesia. So you have to look at those factors if you are entering the profession, in that you won't get salary equivalent to a degree level immediately. So even the nurses took time to get their salary for a BSN. So anesthesia also has to do the waiting game. Another difference I can talk about is we talked about job opportunities is immigration. Now we are in a scale where you have to sell your profession beyond borders. Yes, you have to sell your profession beyond borders. If your profession is only localized, like for the clinical officers, you struggle, because for clinical officers you can't immigrate to another country and work as a clinical officer, because clinical officers, for their case, their profession is only known in East Africa. Yeah, period. East Africa and some few African countries. So you can't sell clinical medicine beyond borders, but you can sell nursing beyond borders, because nursing is required everywhere, every country, in the States, in Canada, in England, you get it. But you can't go out and work as an anesthetic officer in many countries, because many countries have different policies for an anesthesia provider. So you have to adapt to their policies and see how you fit in the system. So you can work, but you need to see, is your program acceptable to in that system? That is the thing. How do you adjust to the system before you work? For nurses it's easy, but for an anesthesia provider, a non-physician, it's not easy. It involves policies. For example, if you are an anesthetic officer and you want to go and work in Kenya, it's different, because Kenya has anesthetic nurses and anesthetic clinical officers. So you have to choose between those two where you fall before you go on. So each country has its own policies on how you can work there as a non-physician anesthetist, which is very different. But for the nurses, the system is straightforward, because nursing boards communicate to each other. It's a popular way. So it's more easier to immigrate and work as a nurse in Dubai, in Qatar, in UK, because there is a straightforward system, which is different for and the anesthesia providers. So you have to look at those goals when you are deciding which profession you want to join. So you have to look at, if you have long-term plans of immigrating and working in other countries, you can look into the nursing section. But if you want to be localized, you can do a bachelor's degree in anesthesia. So everything depends on what you want, but all professions are good depending on what you want. So let's talk about more of what the professions provide in kind of independency. The anesthesia providers at the bachelor's degree level are more independent. They work solely in their department compared to the nurses. Nurses, everything the provider, the doctor, has to be on it. But for anesthesia providers, once they bring you a case, you anesthetize the case by your own, by yourself. You get it? Or you have that sole independence as an anesthetic officer or an anesthesia provider. The independence is there to do your work without interrupters. You can consult the anesthesiologist, but in most cases, you do the work by yourself. So if you want that sort of employment, that sort of work where you are independent, you are consulted on what type of anesthesia to give a mother with obstructed labor. You are consulted with what type of anesthesia to give a person with obstructed hernia, all those kinds of cases. You are consulted which anesthesia should we give in a sedating a child who needs endoscopy, which anesthesia do we need in having repairing a third degree tear. You are consulted. That's the beauty with anesthesia. You are consulted. So if you are kind of that person who has that core independence, where even the doctors consult you, the consultants consult you, you can go into anesthesia. There's that sort of independence, which is very good. And also the beauty with bachelor's degree in anesthesia, or doing anesthesia the whole as a non-physician, if there are those small jobs which you can do, which nurses can't do, like inducing. Those are so many MRI where they want those small sedations. You can get the 150, the 200. uh, yes, there are those small jobs which you can get, side jobs which the nurses can't get. That's the only beauty with it. If you are locally based, anesthesia is good. You can get a lot of side income of your nursing, of your general hospital fee. There are those small jobs you can do. That's the only, if you got some bit of independence and some side income, anesthesia provides a lot of that. If you know your anesthesia, you give your patients wake up in time, they don't lay on table, you've crafted your skill, you are good at what you do, you are quick at your spinals, you are quick at your procedure. That's what they want. You become popular and you get more people paying you to provide anesthesia services. That's the sole independence with about the profession. It's the only thing which I can say anesthetic providers have over the nurses, in that the nurses don't have that sort of work. All their shifts, they have to work 12 hours, but the anesthesia providers, they have some bit of respect and independence. So you have to choose each of those. Do you want independence or do you want popularity or profession? So each profession has its own advantages. So you have to choose out from these which works for you. If you think doing a bachelor's degree works for you, you can do it. If you think doing a bachelor's degree in anesthesia works for you, you can do it. All professions are good, but each profession has some small advantages over the other. But all the choice comes to you. What do you want? That's my video. Thank you very much for tuning in. I'm going to be a little bit consistent than before, bringing you more good tutorial, more good educative content. If you have any question, anything you'd like me to talk about which you feel is on your interest, you can post down in my channel. I always answer all comments people bring to this channel. All educative comments, I always answer them. And if you want to reach me on a personal basis, I don't share my number because it's a social media platform, but you can use my email. There in my settings, I have my email there. You page me my email. I always answer every person's comments because I respect you. You have questions, so if you have any questions, anything you want to say about my videos, any question you want, any kind of advice you are seeking for, I'll always be able to reply your email and your messages. Thank you very much for tuning in and watching my content.